Good morning to all of our brothers and sisters in 1199, to friends and allies, and of course to members of the media. Thanks for joining us. My name is Rob Baril. I'm the president of the New England Healthcare Employees Union, District 1199. And we are together today because we wanted to provide an update on what is taking place in Connecticut's skilled nursing facilities. Across the state, there are 213 nursing homes, of which 1199 represents workers in 69 of those facilities, over 6,000 workers across the state of Connecticut. I think really just by way of starting, we should just say that the values that healthcare workers exhibit at all times, particularly in times of crisis, are really about making sure that when any of us is ill, when any of us is distressed, in nursing homes, even outside of times of crisis, many of the residents are there for their end days. And what nursing home workers, skilled professionals, caregivers know how to do is to come together, regardless of people's background, their race, their income, their gender, whatever life experiences. Nursing home workers know in their caregiving, in their labor, which is based in love, how to take care of people who are distressed. And I think that what nursing home workers are doing right now in Connecticut is, absolutely the most heroic example of that spirit. They are giving of themselves at great personal risk and also at risk to their families. As of today, we can confirm that tragically 3 of our members in nursing homes have lost their own lives due to COVID-19. We're aware of at least 1 family member who died as a result of a transmission that she got from a nursing home worker. We have many, many members of our union who are extremely ill. We believe that we probably have over 1,000 positives out of the 6,000 nursing home workers that we represent just in those 69 1199 nursing homes. And so, our members are making incredible sacrifices and taking incredible risks and showing up to work every day in an atmosphere where they are under-resourced and continuing to do their jobs. That I think is really the starting point. A lot of the responsibility for that obviously lies with the federal government, where we have a president who, frankly, the suffering of working class people, of the disabled, of women, of caregivers who are overwhelmingly female, who are overwhelmingly Black and overwhelmingly brown in the state of Connecticut, but of all caregivers, regardless of race, the suffering and the risk, and let's be real, the death that is taking place of both nursing home residents and nursing home caregivers, it is invisible to the President of the United States. And that I think just needs to be stated. He has the ability to invoke the Defense Production Act, which would produce hundreds of millions of units of personal protective equipment and would save lives, and he has not done that up until this point. In the state of Connecticut, we have a leader in Governor Lamont who has been, working hard to make a difference for all essential workers, for frontline healthcare workers in particular. We are making some progress in nursing homes, but we still have a significant ways to go. That is true in the case of funding. That is true in the case of personal protective equipment. We still have caregivers that are using black hefty trash bags as gowns. Okay, and so as a nation, what message does that send? Our nursing home residents are not trash. Our nursing home caregivers are not trash. We need to get to the point where every single nursing home worker, every single essential worker has all that they need in terms of resources to keep their residents safe, themselves safe, and their families safe. But we are making some amount of progress. One of the challenges that I think that we want to really highlight today is just the count in terms of the most grim measure of the way that COVID-19 is impacting us. which is the death total in the state of Connecticut. From what we've seen, the numbers that the state is tracking in skilled nursing facilities are a significant undercount in terms of the actual number of fatalities. Our caregivers, CNAs, nurses aides, licensed practical nurses, registered nurses, who are the hands-on caregivers in those 69 skilled nursing facilities, have been at the bedside of their sick residents, have held hands in residents' final moments to offer them comfort as they've passed. And so we're able to actually keep a track facility by facility in terms of the number of fatalities. And so just in the 69 1199 skilled nursing facilities, there are 399 fatalities that we have had reported by members. That's significantly over what the state has reported. If you just add the extra fatalities that we're aware of in the 1199 facilities, that takes the statewide total in nursing homes to about 646 fatalities statewide. So we think that the number of fatalities in skilled nursing represents well over 50% of the overall deaths in the state. Why does this become important? Well, because again, if we think about what the epicenter of the disease is in Connecticut right now, it truly is in our nursing homes, and that means that we need to resource the nursing homes appropriately in terms of extra funding so that they can procure personal protective equipment. There has been, significant price inflation in the cost of personal protective equipment. So states providing extra funding for nursing homes beyond what was released last Friday is absolutely vital. Secondarily, the number of workers in our union, as I mentioned earlier, who are ill, we believe is somewhere over 1,000 illnesses out of a total workforce of 6,000 people. There are around 15 facilities where staffing is absolutely collapsing. It's cratered. And so to be able to make sure that there is the staffing necessary to provide the residents with the care that they deserve and that they need, particularly in this time of crisis, there's a need for extra funding. And so those are the two key pieces. There's some other pieces that are necessary, we believe, for nursing home workers right now in terms of making sure that their own healthcare expenses are covered. We have members that are incurring thousands, tens of thousands of dollars of medical expenses as they are becoming ill, as people and their family members who've contracted COVID-19 from them are becoming ill. There are just common sense solutions which can be created. We'll remember back that during 9/11, when first responders rushed into the World Trade Center area and buildings were collapsing, and they ingested dust that caused huge respiratory problems. We came up with national resources to make sure that those first responders were not driven into medical bankruptcy and had the care that they needed. Our frontline essential workers, our healthcare workers in Connecticut, all essential workers in Connecticut need that same type of support in terms of funding to provide for their own healthcare. So that being said, obviously the most informed people in the state of Connecticut at the moment in terms of the day-to-day conditions in nursing homes are the caregivers themselves. And so we have a number of reports that we're going to have from nursing home workers across several skilled nursing facilities who can talk and testify to the realities that they're facing right now. We're going to begin with Yvonne from St. Camille. I'm sorry. We're going to start with Michael Furlow, who works at Regal Care. Michael, would you kick us off with a report from Regal Care?
Yes, good morning. I'm glad to be with you today. So at Regal Care, we have over 10 positive COVID residents. Several are in a hospital now, so we're waiting for them to come back. We have more tests pending. All of the positive residents are moved onto my unit. That's on the third floor. So any resident in the building that is positive is immediately moved to the third floor to my unit. So on that one unit, I take care of all of the COVID residents in the building. And the problem that we're having, besides not having adequate PPE, is that we're also being asked to work an extra shift if we don't have coverage for the shift after it. So what that does is that puts us over 17 hours working on a COVID unit, which is it's just excessive. It's you know, the longer you spend around a potentially deadly virus, the greater your chances are of catching it, the greater your chances are of bringing it home. So the staff, the nursing staff, we're extremely stressed. We don't feel that we're getting the support from the administration. We barely even see them. So right now, you know, our main focus is to provide quality care, but at the same time, it's to keep ourselves and our families healthy also.
Michael, thank you. Next, we have Nicole Jefferson, who is a nurse's aide at Rocky Hill, Apple of Rocky Hill.
Yes, hi, good morning, everyone. I've been at Rocky Hill about 2 years, and with 1199, it's a great union, and I'm happy to be a part of a team that is always looking to better union members. And during this pandemic, you have healthcare workers, as myself, showing up to work every day, trying to do the best we can to take care of our residents. What we are demanding and asking for is proper PPE to protect ourselves, not only ourselves, but our residents and our families. And it's very scary to know that you're showing up to work every day and to perform your duty effectively, and we are not able to get proper PPE to protect us and the residents. Now, most of the nursing homes have positive COVID residents, and we are asked to wear Johnnies because the building, the administrator is not able to provide us with the equipment that we need, but we have to perform our work effectively. How can we do that when we are being exposed? We show for an 8-hour shift, 16-hour shift, and we don't even feel safe to take breaks or use the restroom, because when we get one Johnny, not even when they ask us to wear a Johnny over our uniforms, which Johnny does not protect our hands or anywhere, but we have to wear one Johnny throughout the whole shift and not able to change it because they don't have enough Johnny to supply residents and staff members from the virus.
Thank you so much, Nicole. Next, we have Zena Bennett, who is a CNA and nurse's aide at St. Joseph's Manor in Trumbull. Zena was tested yesterday and is unfortunately likely to have COVID, and we know that she's a fighter and is going to pull through. But Zena, please give us some words.
Hello, everyone. I was going to correct Rob. My son, my 12-year-old son, was actually tested yesterday. I had to leave work the other night. He called me about 1:50 in the morning, pretty much in tears because for the last 3 to 4 days he's been having a severe headache. He's also an asthmatic, so he also complained about chest pains. So I had to take him to the hospital, which everybody's trying to stay away from. And we tested him yesterday afternoon, and all I could do was pray. This is the biggest thing that we all fear, is bringing it home to our family members and our kids and spreading it. At our facility, our residents are not even separated by COVID-19. They're still mixed in. And it's difficult for us because a lot of times we're running out of gowns, and everybody in our building is not getting N95s. They're only being select about who they give it to, and it's difficult. We do have positives as far as staff members in our building. Unfortunately, one of our staff members lost their mother because she brought it home to her mother. All of us are like fearful, but for me, I still go to work because I know that these residents still need us. They're our family. Like they don't have their family there. We are their family, and we have to stand by them. When you see residents that you've seen 2 months ago that were fine, and now you see them going down and their colors are changing, it's heartbreaking. Every day I cry, and I just keep praying. It's like certain things that we're asking for. I don't think that we should be fighting with management to get. I think that it should just be given to us, like especially in this situation. It's just really heartbreaking. It's like if nobody, it's like you can't even describe it the way you really want to describe it, because it's something's like you don't want people to see it, but if you see it, you will understand it. And it's just hard. I mean, on Sunday, we lost 4 residents within 16 hours. Yesterday, we lost 2 more. Every day, the numbers are going up, and some of these people were tested. Some of them were pending, and some of them weren't even. One of my guys, he changed on Saturday, and I reported it, and they weren't going to test him until Monday, and he died Sunday. All we can do really is just pray, and I pray for all of our nursing homes, all of our sisters and brothers in healthcare, because it's a nightmare. It's really a nightmare. I mean, even to know that my son had to be tested, it's scary. It's scary. When you watch your 12-year-old ask the emergency room doctor how many kids died from it, that's something you never want. I never can imagine. I'm sorry.
Zena, obviously, we're all praying for your son, sending you love and sending him well wishes. We're with you. Next, we have Yvonne Robinson, who's a nurse's aide from Regal Care of Southport.
Good morning, everyone. I've been at Regal Care for 29 years, and I'm at my wit's end. There. Right now, we have a manager in the kitchen who's fighting for his life from COVID. As far as I know, they said the administrator was tested for it. There's a lot of CNAs like about 12 CNAs are out with COVID right now. They don't give us, I had to get upset Monday because I went in there was nothing to work with. And I was ready to leave and go home because there's no way I'm going to go in there and work with nothing. The supervisor was telling me that, well, we don't have anything. What? I'm not going anywhere if we don't have. But eventually, they have the stuff and they're hiding them. But they finally gave it to us. They're not, when we tell them that the patient, the changes, you know, because we know how their body change or their faces or the expression. And the one lady, she was there for like 2 months. She was okay that Sunday. And by Thursday, she was gone with COVID. Her and her husband in the same room. I had to ask the supervisor, aren't you going to check the husband? Because if the wife died from it, I'm sure the husband has it. So I had to be getting on their cases about, they have everybody mixed together there. You know, yesterday we had 3 residents check for it. 2 was in the hospital. You know, it's so scary. I feel like sometimes I just want to stay in my own house and hide underneath my covers, but I know I can't because I have to do what I have to do. I have my daughters to work from home. I worried when I come home that because she doesn't go out there, and I'm like, I don't want to bring it home and give it to my family. So I come home and I'm hiding in my basement, tell them I'm quarantined. I can't go. My daughter said, I can't even hug my mother at the facility. And then there's another thing with a hazardous pay that I have a problem with Regal Care of Southport. HR, me and her had a conversation about when it first started there. Then she ignored me, like she's telling me when it started, and she's not the one there have to deal with it. It's us. I'm the one that called the coworkers. How are you doing? I asked one nurse, she's home now with it. And I asked the DNS, I said, you guys call a check. Oh, I'm going to do it, not right now. I'm the one that have to do it because we have to fight for each other. They don't care. They only want to make sure our body's in there. They don't care if we're sick and we can't be there. And it's so scary. Every time I go in there and I worry when I leave at 3 o'clock. And it just it's starting to mess with my head. It really started to, because I'm worried about my family, my coworkers. There's one lady, she takes care of her mother and her husband who's ill. She has it now. I'm worried about her. Imagine giving it to her, both of her family, her husband and her mother. And we're not getting any help from the DNS. She walks around like she's in oblivion about stuff. You know, it's like we have to be protecting each other, even with the gowns. They don't want to give us. You know, I had to threaten the supervisor. I said, Channel 12 News is going to be sitting out there right in the front of this damn place if y'all don't give us nothing to work with. But they find them. They're hiding them. I don't understand why. And they have them boxes. I went to the HR room and this lady had boxes and stuff in there. And I'm like, why the hell am I arguing with you people for stuff when you have them? Why are you all hiding them? I wish you could have called the police on them to believe me. That's how I felt. Because we're supposed to go in there, put our lives in danger and the residents. And they don't care. They don't care.
Thanks to all the members who just spoke and talked about what is taking place in these facilities. All of our essential workers, all of our healthcare workers, but especially all of our nursing home workers across the country and across the state truly are the heroes who are risking everything right now to be able to hold our society together, to be the glue that makes sure that those who are sick, that those who are most vulnerable, have all of the healthcare and other needs met in this time of crisis. And I just think that cannot be said enough. But what also needs to be said is that COVID-19, this pandemic, is highlighting what has always been true, which is that poor people, Black people, Latino people are denied the same level of care, the same level of resources, the same levels of support that all of us deserve in the society. We know that in places where there's been study, New York City, the death rate for Black people in that city is twice the rate of our white brothers and sisters. We know that in the state of Connecticut, just based on the very preliminary numbers that are now a couple of weeks old, 40% of the folks who contracted COVID-19 were Black and Latino. We think that that number is probably significantly higher at this point in time. And so we need to implement solutions that address the underlying issues. That's going to mean extra funding. That's going to mean resourcing the skilled nursing facilities in urban areas in the same way that we are resourcing the skilled nursing facilities in rural and suburban areas. The Medicaid bump that took place last Friday significantly privileges the skilled nursing facilities in rural and suburban areas. We need to make sure that frontline workers who are becoming ill, who in many cases have healthcare coverage that may result in them having bills of tens of thousands of dollars, are going to be able to get their healthcare costs met by the state of Connecticut. Zena's son, who committed no crime other than being the daughter of a caregiver who has been risking her own life, who has been making sacrifices of her own health potentially. And so her son now is struggling to recover from COVID-19. His healthcare costs should be covered by the state of Connecticut. This is the wealthiest state in the wealthiest country in the world. We need to make the sacrifices as a society that are minimal, frankly, compared to what we're asking of our nursing home members. We'll open up for any questions.
Hi, everybody. This is Matt Karen from Fox 61. Thank you all for sharing your stories. Really appreciate that. Sort of a two-part question. The Governor Lamont at one of his recent press conferences said they've done 120 site inspections at these nursing homes to inspect the infection control procedures. So the first part of the question is, has that been helpful at all, having the state come in? They said they're providing some guidance and advice. And the second part of my question is regarding the PPE. He said they only found one of those nursing homes that was in a great need for PPE, and they were able to get that to the nursing home, but you're still describing wearing garbage bags. So what are we missing?
Yeah, I think we just have to say that again, while there's been some steps in the right direction, we need to go much further. Department of Public Health needs to be much more aggressive. If we get a call from nursing home workers, as happened, multiple times this week, that workers are wearing hefty trash bags instead of gowns. Somebody from Department of Public Health may not show up until the afternoon, at which time maybe the administrator has gotten word that they're on their way and has handed out materials that they have been hoarding. Okay, part of the issue is that the price inflation for PPE has meant that the facilities are spending significant money. So in many cases, the administrators and the DNSs are hoarding the personal protective equipment, okay? And that is just a fact. There are facilities where, again, Department of Public Health has shown up and because there's a need to wash the gowns, which may be reusable gowns, and the gowns may still be wet. Why? Because in those cases, the administrator has not allowed for expanded hours for the laundry staff to do all of the cleaning of the protective equipment, okay? To this point, Department of Public Health has not done what they need to do, which is to fine facilities, okay? They need to penalize the facilities so that they have something to fear if they continue to hoard facilities. And I think that all of us on this call have seen the photos of workers in trash bags. So this is not just in the workers' heads, and we're happy to share those photos. But until we start to see nursing home operators that are hoarding personal protective equipment fined and deal with some consequences, this is not going to change. Okay, and this has consequences in the real world. When the personal protective equipment is hoarded, it means more sicknesses of residents. It means more sicknesses of caregivers. It means more sicknesses of caregivers' family members. And ultimately, it means more deaths.
Hi, this is Lisa Backus with Hearst. You mentioned not only the PPE and that it's being hoarded, but also certain homes are not isolating their COVID victims. Is that part of the reason this is kind of blowing through those institutions, along with the fact staff does not have enough PPE to keep themselves safe, or I would imagine, you know, some residents would need masks and, you know, even the Johnnies, you know, why is someone wearing a Johnny? But, you know, as opposed to actual gear. So can you speak to, I guess, the problems? You just mentioned the PPE, but what are the other problems that are sort of causing this to blow through these institutions and sicken staff?
I mean, the biggest problem is you know, look at how easily it is for the virus to spread from one resident to another. Okay, we have a healthcare facility in the New Haven area, which did not have any positives as of a couple of days ago, and as of now, it's a small facility. 100% of the residents have tested positive in that facility. 100% of the residents. So again, until there's the maximum level of personal protective equipment that prevents transmission from resident to resident, from resident to worker, from worker to resident, and from worker to their own family members, this virus will not be contained.
Wow. And again, you're saying it's sort of because the homes have to pay for it, and it's, you know, and the cost is going up, so they're sort of hoarding it rather than allowing everyone to be safe.
I mean, and it's not just a matter of hoarding. I mean, there is a real issue of scarcity, which again can only be solved if the president invokes the Defense Production Act. Okay, the president has a responsibility to the people of the United States to invoke the Defense Production Act so that hundreds of millions of units of PPE are produced. Number one. Number two, that helps to bring down the price because again, the scarcity is driving up the prices. But then number three, of course, yes, if there's more availability, there's more ability to distribute, and the nursing facilities at that point then have a responsibility to get the equipment out to the caregivers. I want to be clear, members of our union have had to institute job actions at probably 40 to 50 different nursing facilities because the management at those facilities at one point or another has been hoarding the personal protective equipment. Okay? Wow. Our members have had to fight tooth and nail in many, many cases, far too many cases, to get the administrators to hand out the personal protective equipment. There are over 1,000 members of our union who are now ill. We know of 3 fatalities. We know of any number of people who are in intensive care. We're praying that those folks are going to pull through, but we know that when people are older, and we have members of our union who are in their 50s and 60s, we know that when people are ill enough that they get to the point that they are admitted in a hospital, then in some cases the worst will happen. So until we get to the point where, you know, both nationally, but in the skilled nursing facilities, there is the level of resourcing that is necessary for all workers to have maximum personal protective equipment, we're not going to fully be able to contain the virus.
Hi, Rob. John Craven from News 12. Just real quick, you said you had three members who have died. Can you tell us which facilities those are at?
Yeah. Kimberly Hall North in Bloomfield, Parkway Pavilion in Hartford, and West River Care Center in Milford.
Hi, Jacqueline Rabe Thomas from the Connecticut Mirror here. I'm curious if there are state actions that can be done or that you have requested be done to help resolve the PPE. It sounds like they're doing inspections, but from what I'm hearing from you, that hasn't entirely resolved the issue. So I'm curious what you see as potential executive orders or other solutions to this might be.
Yeah, so again, the inspections need to be much more aggressive. We've gotten to the point where we have some inspections, but for several weeks, the DPH officials were often relying on the word of the administrator. They make a phone call, talk to the administrator at the facility. Do you have enough PPE? Yes, I have enough PPE. Okay, end of discussion. We're all good here. Okay, so. Department of Public Health needs to be much more aggressive in continuing the on-site inspections, okay? I can't understand why in a circumstance where workers are taking photos of themselves in black hefty trash bags, somebody's got to explain to me why it is that those facilities are not getting fined. I don't personally understand that one. And then on the question of funding, there is a major and I would say again, on that question, whistleblower protection for workers who are being threatened. We know that particularly at non-union facilities, we've had many reports in non-union facilities of workers being threatened with discipline. Okay, where we have the union, there's some job security that workers have, and we have the ability to fight back. So it's not as easy to silence us. But in non-union facilities, if the boss threatens that the workers are going to be disciplined if they report, that's a major problem. I would say, again, the other issue is in terms of funding. So the state has come up with a flat $400 a day Medicaid reimbursement rate for COVID positive residents. There's a couple challenges with that. Number one is that rate only lasts for that particular resident for 30 days. Well, that doesn't work because the exposure to residents goes obviously way beyond 30 days. If there's one COVID positive resident in a nursing home, we need to start, frankly, treating that facility as if the infection may be rampant, given the example that I just gave at the facility in the New Haven area. Okay, where again a few days ago it was no positives, then it was every worker in the facility or every resident in the facility. So that 30-day $400 rate has got to go up. Second, that significantly discriminates against facilities that are in urban areas. Those urban area nursing homes tend to have higher reimbursement rates. So they may be starting out closer to the $400 rate, whereas there are rural and suburban facilities that are getting hundreds and hundreds of dollars a day, sometimes $200 a day in extra funding. Okay, the urban facilities will have significantly less. And so we need to make sure that we are coming up with supplemental funding that ends that disparity between urban and suburban and rural nursing home for the extra funding.
I'm sorry, I'm not quite following. Why are the urban and centers getting less?
So Medicaid rates are set on a facility by facility basis by the Department of Social Services. There are many less private pay and Medicare patients in the urban facilities because you have a higher low-income population. Medicaid, as you know, is a healthcare program for low-income people. And so they tend to have a pre-existing higher Medicaid reimbursement rate. So when you create a flat number for funding of $400, what that means is that the urban facilities wind up from their higher starting point getting less money in terms of a bump. The rural and suburban facilities, which start out with a lower number of Medicaid residents and a lower Medicaid reimbursement, wind up getting a much higher bump up and much more in terms of resources.
Gotcha. Thanks.
Rob, Keith Fanoff with the Mirror. Can I sort of go back to this issue of funding and take a different approach with it? I follow absolutely what you're saying about the federal government, and I've been looking at this funding level as you and your members have been rolling it out at all the different levels. We've heard about people saying homes are hoarding, homes aren't even doing their laundry because they're more concerned about the bottom line. The state Medicaid bump isn't enough, and yes, it definitely all starts at Washington. But I do want to focus at the state level because the fact of the matter is, as you pointed out, we're working in one of the wealthiest states, in the wealthiest nation in the world, with a record-setting rainy day fund, and much more important, with an overall population that can support a higher tax base than anywhere else. Acknowledging your concerns about the federal government, here's where I'm going. Quite frankly, should Governor Lamont be less focused on keeping the rainy day fund for FY21, spending the money now when you need it, and if we have to raise taxes on the wealthy in 2021, we do it then?
Yeah, I would certainly say that I think that talking about numbers and dollar signs when human lives are at stake, when people are suffering, when again, there's a certain level of sacrifice that we're asking of our frontline essential workers, our healthcare workers, our nursing home workers, that does not exist for those of us who are wealthy enough and fortunate enough to be able to telecommute.
I just saying though, it's quite frankly politically safe in a blue state to criticize President Trump. And what I'm saying is, quite frankly, Governor Lamont not doing enough?
We need to spend money out of the rainy day fund. We need to deal with whatever progressive taxation so that we resource the folks who are taking the frontline risks. Okay. Again, I'll just use the example of healthcare for healthcare workers. There are workers on this call who have health plans that may result in out-of-pocket costs for medical expenses of $18,000 to $20,000. People who on this call may go way above that. So we're under-resourcing them in terms of PPE. We're asking them to take every risk and go into the most dangerous environment that exists in the state right now. And then they may wind up themselves getting sick. Zena's son, if he needs medical treatment, she may wind up with thousands of dollars of medical bills. Have we made any commitment as a state to make sure that we're going to help those workers and take care of their own medical costs? So I think there's multiple ways in which the funding questions, the resource questions impact human lives. And now is not the time to talk about dollar signs. Now is not the time to talk about numbers. Now is the time to resource the human beings that are making incredible sacrifices and taking incredible risks. Do we see their suffering? Do we hear them when they voice their concerns about their risk and talk about what they are going through? Would this population of caregivers be treated differently if they were white and male and wealthy? I think the answer is pretty obvious.
Thank you.
Rob, hi, this is Shannon Miller from NBC Connecticut. Good to see you today, and nice to see all the healthcare workers who so graciously gave us your testimony this morning. I wanted to see if you could talk, again, just quickly, the numbers that you have been able to collect from your nursing home workers, number of fatalities, compared to what that actually potentially could look like? I just missed it earlier. It cut out a little bit on those fatality numbers.
So where that comes from is we've been in communication with nurses and nurses' aides and other healthcare workers in the 69 facilities that 1199 represents. What our members report is across those 69 facilities, 399 fatalities. So if you add that to the baseline number in the non-union facilities, what that creates is a statewide total of 646 fatalities across the state of Connecticut. That's out of a total of, I believe the most recent number, and again, these numbers are just grim. I mean, but I think that it matters in terms of our understanding about where resources are needed. The last number I was able to find was 1,423 fatalities statewide. So if there are 699 nursing home fatalities, that's 49% of the overall fatalities in the state. And again, I think that the 699 number may be an overcount because it does not take into account whether there are uncounted fatalities in the non-union facilities.
Rob, could you just say what day your numbers are calculated through, those 399 fatalities and 1199 homes through
yesterday?
What
yesterday.
day?
Yesterday.
Hi, it's Lisa Backus again. I just wanted to jump in with a quick question. How many nursing homes out there out of the 215 are not unionized? I know you guys cover about 30%, right, of the 215?
Yeah, I think that there's an additional, I believe it's 3 homes that are in other unions. So we are the dominant union in nursing home facilities across the state.
So did I hear that right? There's only 3 other homes that are in other unions, but other than that, you guys have the bulk at about 30%, and it's 69, right? 69.
69 facilities that 1199 represents, and then an additional 3 in other unions.
All right, thank you.
Do we have any other questions?
Oh, I'm sorry. I thought someone else would jump in. I actually do have one other question. You had mentioned about 15 homes out of, I think it's, I don't know if it's statewide or out of your union homes that are on the verge of collapse due to staff outages. Can we have the names of those homes?
Yeah, well, the easiest way, Pedro, to be to just send an email. Is that simplest?
Okay. And I can do that. I can do
Pedro's
that to
indicating
Pedro.
yes. Okay.
Okay. All right. Perfect. Okay. I'm done. Thank you.
Any other questions? All right. Thank you, and just for all of our members that are on the call, you are the most courageous people that I think that any of us have ever met, that I've ever met. I know for sure. And I'm not a religious person, but the only word I can think of is that I'm keeping all of you and your families and your residents in my own prayers. And I send you light and I send you love. Thank you.